Hi, my name is Katie Dodd and I'm with the Geriatric Dietitian. I'd like to take the next 5 to 10 minutes to talk to you about nutrition care, dental health, in older adults. The American Dental Association says that the mouth is a window into the health of your body. And as a dietitian, I'll also say that the mouth is the first route of nutrition. If you have pain, missing teeth, you're not able to chew food, well, then you're not able to get that good, healthy nutrition that your body needs. So when it comes to nutrition, the mouth is the first route. So we're going to talk a little bit about how to take care of dental health in older adults. And I would like to address what I call a myth of the day. And there's this misconception that losing your teeth is a part of getting older. And that is not true. Losing your teeth is not a part of healthy aging. There are many older adults who have all, if not most, of their natural teeth. So a lot of people think that, gosh, when I get older, I'll just lose all my teeth and get dentures. That's just a normal part of aging. And again, it's not. And that's why it's so important that we take care of the dental health in the older adult so that they can chew food and get good nutrition. So let's look at some common oral health problems that we see in older adults. We see dental caries and cavities, gum disease, tooth loss. It might be all their teeth, it might be some. Oral cancer, dry mouth, polypharmacy, and polypharmacy just means that you're taking lots of medications, and a lot of medications have a side effect of dry mouth. And so why is dry mouth so bad? Saliva does a lot of good things in our body, in our mouth. It helps to keep things moving, and when you have dry mouth, and what you have is you have food and bacteria and just different things in your mouth sitting on the tooth and the gum without the saliva to move it around. And that's a bad thing because that can contribute to all kinds of dental health problems, including cavities. So those medications that a lot of older adults on could cause dry mouth and, again, increase risk of oral health problems. We also see higher rates of chronic disease and disability. And what I mean by disability is that the older adult is unable to brush their teeth themselves, and so they're not able to do that good dental hygiene they need to keep their mouth healthy. So what is good dental hygiene for the older adult? And really, this is kind of good dental hygiene for all of us, but what we need to be doing is brushing our teeth twice a day. Flossing, if you're not able to use regular floss, using a pick with the floss that's pre-threaded, or even a water pick. Just the whole point is that we want to get the food out from those little cracks and crevices in the teeth, because that's where really the food likes to hide, bacteria likes to build up, and that's where we find those cavities. If an older adult does have dentures, we need to make sure that they're taking care of their dentures. It's a misconception that, oh, I don't have teeth, I don't need to take care of my mouth. That's not true. The dentures can hold bacteria, can get plaque development just like normal teeth. So the dentures really should be coming out every night, cleaning them, checking them out to make sure the gums are still healthy. And even someone who has no teeth should still be seeing their dentist on an annual basis to make sure that their mouth is healthy. The older adult should also be drinking water with fluoride, because we know that fluoride is very good for the teeth, helps prevent cavities. If someone is smoking, it's recommended they stop, because we know that smoking is really bad for the mouth, and it's never too late to stop smoking. An older adult, of course, should be eating a healthy diet that can contribute to the health of the teeth. And there's also some foods that could actually contribute to cavities, like the sweet, sticky foods, maybe soda pop, those things where you are sucking on, chewing on, or have a long exposed period of carbohydrate or sugar on the teeth. That can increase the risk of getting dental caries, getting cavities. And does that mean that you should avoid those foods altogether? I'd say no, but we definitely want to make sure that when you have those foods, if you're able to at least rinse out your mouth, the best thing would be to brush your floss after having those foods, because we don't want to have those foods sticking on the teeth for that long. Another really important part of dental hygiene is getting regular dental exams, and that includes seeing your dentist every year, getting x-rays, just making sure that the mouth is healthy. And then also getting regular dental cleanings, and that would be at least every 6 months, maybe more frequently depending on the need, but it's really a combination of things that can help keep the mouth healthy. So as a dietitian, there are 2 things that I talk about in my blog on my website that the link is below. But I call them the big 2. These are some hidden oral health risks that maybe not a lot of people think of, but as the dietitian I think of, and that is malnutrition and aspiration pneumonia. If an older adult has a hard time chewing, they might be avoiding foods or certain food groups, and it can contribute to them developing malnutrition. And malnutrition is simply where someone doesn't get the nutrition or the calories they need. They start losing weight and they start losing muscle. And this is a bad thing because if you lose muscle, you lose your ability to function, be independent. Malnutrition also increases your risk of going to the hospital, getting sick. It increases rates of mortality and death. So malnutrition is really a biggie, and it can start with poor oral hygiene, because like I mentioned at the beginning, the mouth is the first route of nutrition. And if you can't chew for any reason, then it can contribute to malnutrition. The other thing that poor oral health can contribute to is aspiration pneumonia. And simply put, that is when you swallow something and it goes down the wrong way. So instead of food going down to the stomach, it goes down to into the lungs. And that can also cause hospitalization, death, all kinds of issues. And you could read more in my blog about what oral health has to do with aspiration pneumonia and how in the heck can that cause aspiration pneumonia and to send older adults in the hospital, but it can. So there's a lot of information in the blog, but I don't want to keep you too long on this video, but I would like to say if you're a caregiver or a family member of an older adult, you can help with oral health. Oftentimes in the everyday hustle of life, we might not think of the teeth in the mouth, but it really is important. So things that you can do to help, you can assist with cleanings and dental care if needed, and that includes scheduling regular dental appointments. If they don't have insurance or maybe are strapped financially, you can help them investigate low-cost options or insurance options where you live to help them get the care that they need. You can also help with meal preparation if they do have difficulty chewing. You can help modify the food, cut it up, provide softer foods. And I think the most important thing you could do is just ask them, how can I help you? Because again, dental health is very important for older adults. You can learn more on my blog at www.thegeriatricdietitian.com. So go ahead and click on our button below to subscribe to these videos and check out the blog. I hope you learned something. Thanks.